Today I'm addressing another extremely common and often underestimated symptom, edema. Edema is not a disease. It's a clinical sign, a visible manifestation that something is disrupting the body's internal balance. It can appear in the legs, ankles, hands, face, abdomen, lungs, or even be generalized. And although many people associate it only with fluid retention, edema can reflect cardiovascular, renal, hepatic, endocrine, inflammatory, lymphatic, or nutritional problems, or even profound states of physical and emotional exhaustion. Therefore, within the Faro method, edema must be recognized as a universal and clinically important symptom. It's not enough to simply see it. You must learn to read it. BMO understands edema as an abnormal accumulation of fluid in the interstitial space. It can occur through multiple mechanisms: increased venous pressure, heart failure, kidney problems, decreased plasma proteins, liver problems, inflammation, lymphatic disorders, medication effects, prolonged immobility, pregnancy, and systemic diseases. Medical evaluation is essential because some edemas can be potentially serious. Pulmonary edema, for example, constitutes a medical emergency. Unilateral edema may suggest thrombosis, and progressive edema can be a sign of organ failure. Faro believes this symptom should never be minimized, nor should it replace the necessary medical evaluation. But Faro also proposes a broader understanding of this human phenomenon, because behind the retained fluid, there may also be a repressed history. Faro analysis: biological conflict and retention. According to Reich-Geerd-Hamer's approach, some retention processes can be related to deep existential conflicts, feelings of abandonment, loss of bearings, or survival experiences. Biologically, water represents resource and survival. In certain states of intense stress, the body seems to act as if it needs to store reserves. From the Faro perspective, this is not interpreted in a simplistic or reductionist way. It is not about saying that all edema is emotional. It is about recognizing that body, stress, and existential experience can interact profoundly. Many people with chronic edema also experience emotional exhaustion, a feeling of being burdened, difficulty letting go of situations, fear, or prolonged states of insecurity. From the perspective of traditional Chinese medicine, edema is often related to alterations in the transformation and circulation of bodily fluids. Specifically, the following may be involved: a weakened spleen, insufficient kidney, lung imbalances, damp accumulation, and energy stagnation. When qi loses its capacity to transform and mobilize fluids, the body accumulates. Internal dampness can manifest as heaviness, fatigue, inflammation, mental sluggishness, or a feeling of stagnation in life. Taoist medicine also observes that often a person lives disconnected from natural rhythms, excessive demands, lack of rest, unprocessed emotions, and a profound disconnection from the body. For Carl Jung, the body also expresses symbolic content. Edema can be understood metaphorically as a difficulty in draining or releasing what remains accumulated in the psyche. Some people carry emotional burdens, obligations, grief, responsibilities, or silent suffering for years. I'm bloated. I can't take it anymore. I'm carrying too much. Everyday language often reveals the relationship between body and subjective experience. From a Jungian perspective, the symptom is not only a physical problem. It can also become an existential message. From Ken Wilber's holistic approach, edema should be observed on multiple levels simultaneously. Biological level: circulation, kidneys, heart, inflammation, metabolism. Emotional level: chronic stress, exhaustion, overload. Behavioral level: sedentary lifestyle, diet, sleep, overwork. Social level: precariousness, inhumane lifestyles, lack of self-care. Existential level: a feeling of weightlessness, inner disconnection, loss of meaning. Faro avoids both biomedical and emotional reductionism. Not everything is physical, nor is everything psychological. The person is a complex whole. Taoism teaches that health depends on harmonious flow. When life loses its natural movement, stagnation occurs. Edema often symbolizes an excess of accumulation, accumulated emotions, accumulated tension, accumulated exhaustion, accumulated responsibilities. Taoist philosophy reminds us that living is about enduring. It is also about learning to move, adapt, and let go. Humanization. Edema profoundly affects quality of life. Many people experience pain or heaviness, limited mobility, body shame, constant fatigue, difficulty working, sleep disturbances, loss of autonomy, anxiety, or distress. Some patients stop going out, stop showing themselves, or stop feeling comfortable in their own skin. That is why Pharaoh insists on something fundamental. Never look only at the edema. Look at the person who lives inside that body. Pharaoh therapy proposes a multi-level interpretation of the symptom. The role of the medical and nursing professional includes detecting warning signs, appropriate clinical referral, cardiovascular, renal, or vascular risk management, health education, functional assessment, compassionate support and active listening, and monitoring of habits and therapeutic adherence. Pharaoh nursing does not reduce the patient to swollen legs. It comprehensively addresses suffering, functionality, and dignity. Role of the Pharaoh coach/facilitator. The Pharaoh coach does not diagnose illnesses nor replace medical treatment. Their role is to help explore levels of stress and overload, existential conflicts, emotional exhaustion, relationship with the body, lifestyle habits, capacity for rest, emotional connection and support, sense of purpose, and self-care. The goal is not to find emotional guilt, but to expand awareness and promote holistic regulation. Pharaoh learning. The body often retains what life fails to process. But no symptom should be interpreted in isolation or superficially. Listening to the body does not mean abandoning science. It means humanizing it. Pharaoh quote, "The body doesn't just hold fluids. Sometimes it also holds fatigue, grief, and invisible burdens." Subscribe to the channel. Don't forget to like this video. Comment you are a healthcare professional and tell me if you would like to train as a Pharaoh coach. Share this video to help create collective awareness. Study with ESSI the Pharaoh Integral Method. Learn science with awareness. Because in health, knowledge is not neutral, it is vital.